again start our YouTube live. I hope you can hear me and see me clearly. I am live on Instagram also and YouTube also. So I hope you can hear me properly and clearly, so that I can start immediately without wasting time. Anybody who is there only? Yes, Dr. Meera and all are online. So I hope you, Dr. Palak is there. So today's topic for basically learning was case taking. Last time we did on case taking, and the most important part in case taking, which I feel that every doctor should remember, is sometimes those symptoms which are very involuntarily told by the patient or seen by the doctor. Like for instance, yeah, good afternoon, Dr. Meera. In case taking, it is very important to understand what are the non-verbal communication. For example, if the patient enters the clinic and he starts speaking, so how does the patient speak? How is the voice? Whether the voice is bass, whether the voice is shrill, whether the voice is uh, these are the very important symptoms of voice first when the patient comes in, sits in front of you. And if it does not speak in front of you, the first important symptom is to you can see the patient's face. And whatever the expressions are on the face of the patient, that is very important to note, because that symptom the patient cannot voluntarily make. For example, if the expression in the patient's face is very confused, or it is said bewildered or astonished or full of despair, he cannot act that. So that's an involuntary symptom. Today I'll just take the expression of the face. That is so important. And when you look at the expression, sometimes you can easily find out and see there are a lot of remedies also which basically are there in these type of expressions. For example, I'll tell you, a patient comes in front of you and says that he is suffering from a simple disease, coryza. Coryza मतलब उसको सर्दी का problem है. And whenever he has coryza, there is symptom as if that he cannot breathe in cold air. There is a lot of running nose. There is a lot of coryza. He cannot breathe cold air, and whenever he goes in the cold, the coryza starts. And then you start asking him symptoms, that whether the coryza is in the morning, whether the coryza is in the evening, whether the coryza is in the night, and he says morning, night. Absolutely, he does not understand what to answer. So just a simple disease sometimes, and you feel how confused the patient is. Look at the face of the patient; he looks absolutely confused. If you open the Mater Medica and if you see the remedies, then you have a lot of remedies, like you have arsenic album, you have a lot of remedy for coryza. But this expression which you see in the patient's face will guide you to a very very interesting remedy. And if you open the rubric and the patient says the look is confused, you have remedies like esculus, you have remedies like arsenic, you have remedies like lycopodium. And then the patient comes and tells you, oh, I have a problem of backache also, which is very chronic. And immediately you come to know that the patient is esculus, because a confused face is a very very important indication of either esculus or lycopodium or arsenic album. So this is the importance of expression. For example, the patient comes and tells you that he is suffering from so and so disease, and you immediately ask him whether there is history of cancer in the family. Did you have cancer? And he said, oh, how can I got cancer? And the expression in the patient's face absolutely changes, and you have an expression, the patient is very much astonished, astonished look. And if you open the repertory, open the Mater Medica astonished look, we have stramonium, belladonna, all the remedy which basically acts on the cerebellum, the mind, the manias, like carbon sulf, like cannabis sativa. These are the importance of expressions, and sometimes, when you're taking the case, the expression of on the face of the patient appears very much childish, childish like. And you say, what a childish patient he is. And whenever the word childish comes in your mind, you think of only one remedy. And which is that remedy? The expression on the face is childish. Which remedy you would think about? Anybody? Most of the time we think about Brata. So this is how You think about Brata, yes, Buforana. But now anacardium, yeah. If you open the repertory and you see childish expression, the remedy would be either Nux moscata or anacardium. But because only one side of mathematics has been taught to you, you only think about most of the time Brata, isn't it? So that is not Brata, that is anacardium. Very much childish expression. And if you have read anacardium, such a wonderful remedy on anacardium, it is written in anacardium that the patient is been disposition to be malicious and seems bit bent on wickedness. Then how is the expression so childish? And then you sometimes understand the remedy in a different perspective. That is anacardium. Anacardium, childish expressions. So this is the importance of case taking, where the non-verbal communication expressions are such an important symptom which only a doctor can interpret. A patient comes to you in front of you and says that I'm suffering from XYZ disease. He's age of 60 years of age, and he says that I have a lot of stress in life, and I have a lot of deaths in family, a lot of stress, brought my family up, and the expression absolutely on the face, you see, Bapre, patient kitna, he looking very dull, very haggard look. And because of that, he says that I have crossed my limit and tried to help my sister, my brother, my family, everybody, and now I am so tired. And you can see that expression of haggardness, the full of cares in the face of the patient. And you see, I had told you, a patient, whenever that the patient tries to stretch himself in life and the expression becomes very tired and haggard, which is the remedy that comes to your mind? Anybody? So I welcome all the doctors, Dr. Meera, Dr. Anja, Dr. Vishaka, Disha, Dr. Weber, Amit, Dr. Madan, Dr. Lisa, Palak, Dr. Mishra ji. So whenever Dr. Alexandra, Dr. Palak, so whenever the expression is haggard, and he has stretched all the limits, and I told you one remedy, when the patient stretches all the limits in his mental and physical phase, the remedy you should think about is Kalikar. Very well said. Kalikar. There are two remedies. First is Kalikar, second arsenic, then we have natramur, we have lacasis, we have phosphorus, we have silicia. But the word I have used, the patient tries to stretch with his responsibilities. Remember that. Don't confuse stretching of responsibilities with precocity, because if you open that rubric precocity, Kalikarb is not given. I told you before, I have seen lot of cases of Kalikarb, very precautious. They have stretched their comfort zone. They have helped so much, going out of the way and helping persons, and then you take the rubric benevolence. But if you open benevolence rubric, the remedy Kalikarb is not there, and that's why you fail in your practice, because your interpretation is very bad. A Kalikarb patient, do read in Mater Medica, stretches his limit. That's why you can see the expression on the face, and that is haggard and dull, and it feels absolutely worn out. That is the face of a Kalikarb patient. He does not need to tell, I'm so unhappy, I'm so tired. You have to see in his face. And that is what I'm telling you about expressions. I hope you understood something about Kalikarb last time, because there are so many Kalikarb patients you'll see, but you'll never prescribe Kalikarb because it is not given in the rubric either precocity or benevolence. I hope you understood something, all doctors. So this is important, the impression. I hope you understood, Dr. Weber, I think I have told Kalikarb on my Sunday lecture without. Yes, so this is the stretching. And if you have seen, in most of the cases, you have elder brother, elder sister taking care of the family, taking care of the younger siblings, because the mother and father are working. They work as a second father or second mother to their siblings. They stretch the responsibilities, and that's how Kalikarb is born. So this is how you have to understand Kalikarb. Of course, everybody remembers natramur and silicia and phosphorus and carbons, but Kalikarb is a very, very important remedy in this case. and exactly a very different expression on the face. The patient looks absolutely old. You can see a 35 or a young and dynamic person looking very old, very old, and he feels as if, oh my god, the patient is 35 and looking like the face is of 45 years of age or 50 years of age. And then you have to start thinking why. In most of the cases, you must be seeing, yeah, he has a lot of stress in the family, he has taken a lot of stress. Everybody takes stress. When you're doing a case taking of the age of a patient of 70 years, 65 years, 60, he has gone through that stress. But how that stress has affected the body, that is important. How to take for prescription. So old looking face, then you cannot think of natromure or kalicum. Then you have to think about opium or guaicum or argentum nitricum or calcarecum or conium maculatum. These are very, very important expressions that you have to look at the face. Now there'll be a problem that how to look at an old looking face or haggard face. Don't look first. If you have seen a case of, you feel the patient is natromure, given natromure, and if the natromure has cured the case, then you can see how is the face of natromure. This is counter proving, counter clinical symptom. You can verify yourself, because I can tell you the meaning of haggard look or old looking look or sickly look, lot of things, but when you see yourself the haggard look, the sickly look, you can never forget that remedy. I hope you understand that, everybody. Sometimes, so this is the importance of the expression. There are a lot of rubrics and there are a lot of symptoms, but these are very, very important to understand the expression of the patient. If you can get the expression of the patient, automatically you basically have few remedies to then select. Because as the remedies keep growing, your Mathemedica keeps growing, you feel tired in reading so much things, in Mathemedica. And sometimes when you look at the patient, you say, how foolish he's looking at, how foolish expression on the face, he's doing like this, like this, like this, foolish. Then again you think of Bratacarb. Yes, Bratacarb has a very foolish expression on the face. Just like Buforana, just like Stramonium, and just like Lycopodium. This is the importance to understand what we call non-verbal communication, especially when you're looking at the face of the patient. First when he sits in front of you, and then you can see how is the face of the patient. This is how a non-verbal case taking will help you or guide you in trying to get close to the prescription. And then you can look at the hairs, then there are a lot of other things. You can look at the eyes or the ears or the scalp or the skin, but the general expression on the face is so much important. You come to a patient, you have seen the face, and you look at the eyes of the patient. The eyes look absolutely dull, like this. The patient comes in front of you like this. Dull expression of the eyes. Then it becomes a very, very, again, important symptom. Dull eyes. And whenever you see dull eyes, 3-4 remedies are very, very important to understand. The first is Noxomica. Very, very important remedies for dull eyes, because there is a lot of weakness, there is a lot of asthenopia, like Entimtat, like Allium cepa. Now, if somebody asks you about Allium cepa, what symptom do you remember of Allium cepa? Anybody? Allium cepa. Very, very important remedy. Very, very simple remedy. Everybody has learned Allium cepa. But now, how to ask something about Allium cepa? Of course, do ask about the coryza. But the coryza of Allium cepa is very acrid, and the nasal discharge is blend. The eye discharge is blend. But what more to look for Allium cepa? I told you something about that. Anybody? Allium cepa. Expression of the eyes are very, very dull. Red eyes with weeping. Ortho doctor advice for steroid injections. Sorry, I have not come to the question answer session, Dr. Arora. I'm just finishing that non-verbal communication. Now see, okay, like Allium cepa may have that acrid tear. Yeah, I am telling you that. Holds the throat during cough. Yes, if the patient is suffering from cough. Apart from that, Allium cepa. There are few points which are very so much important of some remedy that you have to be very sure when you prescribe it, because otherwise every patient that comes to you on the first or second day of coryza, either it is Allium cepa or Justitia or Aurum triphyllum or Arsenic album. But watery eyes, everything is there. But Allium cepa, just ask the patient. And Allium cepa will have basically one. And now remember this symptom. one spot which is very sore or very raw spot on the feet, especially on the heel because of friction. And the patient says it is written that efficacious when the feet are rubbed sore. That is allium cepa. Watery eyes, coryza, everything is there. It is so much written, so much water discharge from the tip of the nose. But then there are a lot of remedies in all fluent coryzas. If the patient comes to you, these are the very normal symptoms, and sometimes you give allium cepa, it works, sometimes it does not work. But ask the patient, this simple symptom, there is a raw spot on the heel from friction. That is allium cepa. And remember one symptom of allium cepa which is very, very important. That is headache ceases during menses. Whenever menses come, the headache is better and returns when the flow disappears. Friction, friction, etc. Allium cepa, patient will tell you that whenever the menses ceases, whenever there is a headache, ceases during menses, returns when the flow disappears. And most of the time we think about two remedies. Which are those remedies? Any doctors, which are two remedies? But the third remedy is allium cepa. Which remedy we think about? The patient says headache ceases during menses, it returns when the flow disappears. Which remedy we think about? Anybody? Which remedy we think about? And most of the time we prescribe that remedy and we forget that simple onion which is sitting in our kitchen is trying to tell you, I am the remedy. Two remedies which we all think, anybody, all doctors, I think everybody knows that. The patient is better by flow. Anybody? Which remedy? Two remedies very, very important. The first is zincum metallicum and second is lachesis. But my dear doctors, do think about, lachesis one is there, not sepia. It is lachesis and zincum metallicum. Zincum metallicum, Mira. But remember, lachesis is there and second is zincum metallicum. But do remember allium cepa. Allium cepa is a very interesting remedy. Same, better when the flow starts, headache starts when the flow disappears. And now I have started this migraine clinic, and there are so many patients coming, and I'm so surprised that sometimes a simple remedy, allium cepa, single dose, cures a case of migraine where these symptoms correspond, and then you start believing. I have read only allium cepa for coryza, acrid coryza from the nose and blend discharge from the eyes, opposite to euphrasia, and we never think more than that. But if you go to the other side of Materia Medica, you find the remedies beautiful action, So these are the very, very important remedies. I was there on the dullness of the eye. So allium cepa, antrim tart, nux omega. Then you have lot of remedies like sulfur is there, nitric acid is there, staphylococcus, dull eyes are there. But these are the very, very important remedies, where the eyes are absolutely dull. I'm just throwing light on this non-verbal communication because there were a lot of questions asked, sir, if there are so many remedies, how to differentiate? So this is how you can get to the remedy sometimes, but just by observing the patient's face and observing the patient's eyes. I hope everybody is getting what I want to tell you something, Anybody? I hope you're getting the answers. I have not still taken there are a lot of questions which have gone up, but I'll just complete about one or two. And then go on basically I'll in the same way. Let me just finish off one symptom of hair, and then I'll come to the questions. Because everybody wants me to ask something about the Materia Medica, and also I'm just telling you something about non-verbal. Sometimes the patient comes to you where there is problem in the hair, and you find the patient tells you that you can see that the lady's hairs basically are so rough and dry, or sometimes the hairs are very, very oily and greasy, and the patient says, however I wash the hair, my hairs are always oily and greasy. Now this is the symptom which is told by the body to you. Appreciate that symptom. The patients tell you that I use shampoo, I use a lot of oil, I have took a lot of medicines, but in 2 days my hair becomes very greasy and oily. And then you have to think about remedies: nitramure, medorinum, phosphoric acid, causticum. Very, very important remedies, And sometimes the patient comes and tells you, whenever I touch my hair, no, I get pain. Hair is so painful that even touch causes pain. Then you have to think about selenium, china, and epismel. And sometimes the patient comes and tells you, my hairs are so matted, they stick together. I have to keep opening my hairs. It's like opening the hairs like this. Or when I comb, it does not go properly, the comb. Then you have to think about remedies. A very, very interesting remedy, Nitramur, Soranum, Mizarinum. But I have got very, very good results with one remedy also, with Ustiligo and Bovista. So these are the very, very important. I think there are a lot of questions which I have missed. I think I'll just come because there are a lot of questions on the WhatsApp. So I'm just completing those questions about hairs. So we have remedies like Ustiligo and Borax, where the patient tries to comb the hair and the hair sticks at the end because the ends of the hairs are so stuck up. And if you open Boric Mater Medica, such a beautiful, like it is written that hairs become tangled, they split and sometimes they stick at the ends and it is difficult to comb. And one of the very beautiful symptoms of borax that you must always remember. What is that symptom of borax? Anybody? What symptoms of borax? No, lachesis is there. I'm not telling, but there are others. What is the symptom of borax? Anybody can tell me? A very, very important symptoms of borax in relation to hairs. Don't always look for the dread of downward motion of the inferiority complex or the lot of ulcers and lot of stomatitis in the tongue. Look something more. Write down in your Mater Medica that borax is a very, very important remedy where there is wild hairs. The eyelashes are wild. Wild. The eyelashes are wild. Itne bade eyelashes रहेंगे. They are wild, going here, going there, going straight. A very, very important symptom of borax, Tendency to wild hairs of the eyelashes. And you see the eyes of the patient, you find, oh God, how are the eyelashes? Some are very straight, some are going left, some are going right. Wild hair lashes. Remember borax. Don't remember borax only for ulcerations and aphthias and all. It's okay. They are also important. But if you understand borax, I had a case where the patient was suffering from recurrent pus, recurrent abscess in the skin. So many abscess every time the patient used to get, and taking a lot of medicine. I also gave him sulfur, I gave him silicia, but it got never cured. So when I shot the patient, the eyelashes were so bad, so wild, and I prescribed the patient borax. And just to confirm the skin symptom of borax, it is written in borax, unhealthy skin, slightest injury suppurates. See the beautiful area of action of borax. Same symptom written in silicia, same in Heparasul, same in Mercurius, same in Calendula, and same in borax. But we never think about borax for unhealthy skin which suppurates. So just by seeing the eyelashes, I found that very something because of a periodized mind, we always think about sulfur, silicia, Heparasul, Mercury, and Calendula. But when the cure was not coming with the basic routine medicines, just I saw the eyelashes and prescribed borax. And when I read the Mater Medica of borax, it is written that every little injury suppurates. So it is so important to understand the expression and then see at the face and see the eyes, and you can differentiate remedies fast. So this is just, I wanted to share something about case taking, which I had a lot of questions on my WhatsApp and my Facebook and all. I hope you understood something about the case taking part. I don't want to treat you the whole cliched stuff, what to ask, the family history, past history, but the importance of non-verbal communication and how does it affect your prescription, that is important. So I'll be only sharing some clinical tips with you, what I've seen in my practice. So if I'm not able to tell you the whole proforma of case taking, don't be worried. Just see what I want to convey. This is important. Okay. So let us go to the question answer sessions. I can only see one question in front of me of Dr. Sachdeva. There are questions which have, I think I have scrolled up, so you can always write the question. This is a question: patient 25 years of age, stress of performance, always doubts himself, loss of confidence, thinks of future and past, prepares himself before asking something. Fine. Continued with Visualize that he is meeting God or Father. Heartbeat is increasing for waking up. There is shivering and sweating in the feet after waking, loose motions and loss of appetite also. Now, Dr. Sachdeva, see, when I was there doing case taking, I had these type of symptom in lots many of cases, and whenever I had prescribed just because of lack of confidence, that most of the people have, don't prescribe on this, because if you see want of self confidence, that difficulty speaking in public, most of them have. I also had before when I started my YouTube live, Instagram live, how will I answer questions, how will I remember the remedies in front of everybody. I also had a problem, and gradually it went off. Sometimes today also I feel that if somebody asks questions and I can't remember the mathematica, so it's basically matter of what you call continuous reading and continuous exposure. This confidence automatically will come. Of course, it is written in a mathematica that in Cilicia it is written that what do you call, a lawyer who's practicing for so many years, suddenly when he gets in the court and he feels that he does not know anything and cannot remember anything, there's total lack of confidence, then Cilicia is given. Okay, if that is the case, then that is important. But just because of lack of confidence and he feels fear in appearing in a stage and all, don't prescribe Cilicia or Ambragrasia or Lycopodium or Kali Carb or petroleum or phosphoric acid or natrium, because this will, I have seen in my practice, it is not help. Go more deeper and try to define some symptoms. Why is the fear? Was the patient timid in Sora? Maybe the patient was spoiled in Sora, or there was a lot of dominance in Sora, or there was a lot of admonition in Sora. So what was that? And then you can automatically go and prescribe the remedy, asking what was there, and that is the cause maybe. Or is born because his father, mother had the same problem. That is you have to see. Okay. I hope you got some inputs about that. मिश्रा जी, आपका सवाल है एडिमा ऑल ओवर बॉडी, हेरिडिटरी फाइलियरिसिस, अस्थमा, कॉज ऑफ प्रेजेंट इज वर्किंग इन, कॉज ऑफ प्रेजेंट हेरिडिटरी फाइलियरिसिस अस्थमा, हेरिडिटरी अस्थमा है तो आपको दो रेमेडी सोचना बहुत जरूरी है. एक है आयोडम और दूसरा है नाइट्रम सल्फ. मैटेड हेयर्स, yes, you can have remedies like mesarinum, borax is also there. Sir, I need help for you for a family member of mine who has been suffering from recurrent episcleritis. How can I connect you for that? Yeah, I think you are there on the WhatsApp, so just put a message on WhatsApp. So we'll send you a case performer, fill up the case. We'll ask the patient some questions. My assistants basically will take the case on the phone and then we can follow up with the case. Yes, so can we go further? Sorry, there are questions on Instagram I forgot to answer. Yeah, the same questions. So yes, can we go further, or do we talk something about the expression, the face? So that could be, see, we have some questions. Yeah. I think if the questions have scrolled up, you can always write, because I may have missed that question. So sometimes, yes. So we'll one patient had come to me that he told that whenever I am chewing, so whenever he's chewing, he often bites his tongue. The tongue comes in between the teeth, and I thought, okay, this is quite normal. So there's no need for medicine. Maybe his jaw line was not proper, or the jaw was not proper, so he must have. But every time he used to come, the patient used to tell my tongue has been cut and there's bleeding, because whenever I'm chewing food, I bite my tongue. And his mother also came and told he has a bad habit and XYZ. So then I basically wanted to know exactly if this symptom is present in mathematics, and I found this symptom beautifully explained in nitric acid. Nitric acid, ignition, one remedy of anacardium. And the patient came out with a beautifully with nitric acid 30 single dose, and he came out with that. And exactly opposite symptom, which I had a case where I was more interested in treating that case. The patient told that if I'm not eating also, if I'm not chewing also, I sometimes bite my tongue like this. When he's working, he's always moving the tongue. He bite when he's not chewing also, he bites his tongue. And again, when I searched in the Mater Medica, it was a very, very interesting remedy. And the remedy was, you must have heard this remedy, Diascorea villosa. Diascorea villosa. And it is a very, very interesting remedy for persons having very feeble digestive power. मतलब उनका पेट हमेशा खराब रहता है. Now, every time when a patient comes to you and says that my stomach is not good, we think about Naxomica or China or Entim crude, where Entim crude is given that it's a remedy for the extremes of age, old and new. And if you see Diascorea villosa, it is written that digestion is very feeble, especially old persons also and young persons also. And the person basically bites their tongue even when not chewing. This is a very, very important symptom of Diascorea, and the patient came out beautifully with few doses of Diascorea 200. I hope you understood this. This is case taking non-verbal communication. Yes. So this is, yeah, Ignitia is there. Wow. Well, that is, and I'm very happy that you should, yes, Diascorea. I'm happy that Diascorea is DISCO, yeah, Diascorea villosa. And I'm very happy that you all are sharing your sharing your experience. See, one of the doctor has shared that the case came out beautifully with Ignitia. And I told you few remedies, the nitric acid, Ignitia, anacardium, which I have used with very good results, and Diascorea also. So it is important to share your experience so that the transparency of clinical verification is always there. That is important for me, that you must have got results. It's not meeting, it's beating God or Father. Yeah, so Dr. Smith, whenever you have, Dr. Sunita, Sachdeva, whenever you have lack of confidence and you have fear of performing and you are always nervous what to do, in these cases you get these type of syphilitic thoughts. We get these type of, so if you have, if I was the doctor treating that case, I would have not taken the symptom that beating God or Father. You ask, what is Sora? Why beating Father? Maybe he is very annoyed with the Father. Father did not let him do what he had to do, so he's annoyed with the Father. Ask him why. Then you can easily prescribe and go to the remedy. So yes, I had Dr. Smith, Ignitia. Dr. Madan has a question. A female 35 said has fear to finish office work, must do her best, having fear people will criticize her, they will leave me alone, lack of confidence, mouth turns on right, vertigo motion. No, I did not get the question, doctor. Now you have basically a person who feels that he should finish the office work very fast so that people does not put fingers that maybe you have not done the work. Now, simple as that, the patient basically has a lot of he feels that there is a lot of anxiety of conscience. He feels that he has to finish the work others people. So basically he has that timidity and fear also. That is there, an anxiety of conscience. So we have a person who is basically a diligent personality. Whatever work is given to him, he has to finish that work so that nobody points on him. So he does not like people having bad notions about himself or people criticizing him. So he is a person who basically cares for others' opinion also. It is not lack of confidence, it is basically his duty he feels. So we have remedies like phosphorus, we have carcinosin, we have calcarea phos, we have pulsatilla, silicia and tuberculinum. These remedies you have to think about. And if you basically give the patient thermals also, like if you see that the patient is by chance thirstless, so if your patient thirstless, then we have remedies only calcarea phos, carcinosin and silicia. So this is how, and surprisingly calcarea phos is chili, silicia is chili and carcinosin is also chili. Welcome, Dr. Edlizi. I think you have come after a long time. So I hope you are enjoying my session, because whenever I feel that the persons who have been listening to me for years now, if they don't come, so I feel that I'm lacking in my knowledge. So do tell me that if you are enjoying, otherwise I'll change my way of speaking also. So it's, sir, please explain shifting migraine pain of either side of male 25 years of age. No. See, migraine and it is so it is I'm so happy that there are so many cases registered for me migraine and wonderful results, wonderful results in case of migraine. And whenever I've seen cases where the patient had changing and shifting symptom, don't prescribe on that. If you prescribe only on symptoms of migraine, for example, migraine right side goes from the comes from the behind and settles on the right eye, that will only cure that symptom and something else will occur. Get to the core of the case. We have seen in migraine there is one tendency, there is a one basic trend in a patient of migraine that follows in him, and because of that he gets that lot of migraine and pain. So do take the case and share your case, then we'll be able to work off the case and I'll tell you the remedy in the YouTube or Instagram live, and you can prescribe and see the results. Okay, so don't prescribe only on one symptom. How are square faced as per your experience? Yeah, square faced person. So it is said that whenever the person has square face, that means those personalities basically are very strong personalities. they have they have weightage for their opinion. वो जो बोलते करते हैं, बहुत फर्म रहते हैं अपने डिसीजन पे, बहुत डिफाइंट रहते हैं, बहुत मेटल क्वालिटी उसके अंदर रहती है. These are the very very important and entry point of the cases who have strong face and who have basically what you call square type of faces. Of course, persons who have been born or innate character, by doing gym and all, you can basically make that face, but then innate character is very very important. So it's and migraine disease basically, Dr. Amit, such a painful disease. It is such a painful disease because during the attack of a classical migraine or vascular headache, the patient is so much stressed, so much painful, so much despair. He can do just anything to get rid of that migraine headache. So it's important to understand the case and then prescribe. Okay, I hope you understand, Dr. Meera. Yes. So I'm so happy that you're asking me questions. What I wanted you to answer, these are non-verbal communications, and these are very important because if you are able to get those non-verbal communication, like for instance, I told you allium cepa. Now, allium cepa is so close to zincum metallicum and lac-acid in headache, the patient is better by flow. But we never think about allium cepa. Like Diascorea villosa, so important remedy for feeble digestion in young persons and old people also. That is Diascorea. Sufyan Mirza. There is one, I think Instagram has no sound. I'll just check. Just a minute. I hope you can hear. I think in YouTube people can hear. Instagram the sound is a problem. So I'll just check out the sound. Okay. Thank you. If he looks down from a certain or high, or look at the photo of God, he visualizes that he's beating God or Father. Rubric for this. Yeah, you can hear. I think Instagram has a problem. Okay. Yeah. So he feels that he's beating his. Whenever he visualizes that he is beating God or his father. Now, if you can take that symptom maybe as a concomitant symptom, whenever he looks the God, then you can go to the Fata Carpetans and look at the associated rubric, and you have about 9 remedies and go. But I still feel that you have to still ask something more to get the remedy in this case.
You can or you remove that.
Just a minute. Instagram. I hope Dr. Mirza, you can hear it now. Sufyan Mirza, can you hear it now? I'll just check on the Instagram. So we can hear, yeah. So patient male anxiety, fear of crowded places, fear of narrow places. Mother had accident when pregnant for son. What trauma could be while mother pregnant? I think there's a problem in Instagram, so we are trying our best, Dr. Mirza, to rectify it. I'll just see, just a minute. I'll just check first. I'll just continue with YouTube. I'll see that. So, so what trauma would So first of all, Dr. Madan, you have to ask the doctor himself or the patient himself, know what she feels at that time. What is she feeling at that time? That is important, no? So the trauma, the doctor can tell you better than anybody else, because she has she has been what you call had this problem. And whenever this fear of crowd, or mother had accident when pregnant, what did she feel? Your voice is low here. One thing, sorry. Just a minute, okay? Live video. Yeah. So just a bit. Sorry. So mother had accident when pregnant son. So you have to ask the patient what did the patient feel at that time. The patient's feeling basically is told by the patient only. No, we cannot try to make hypothetical say that the patient felt very sad, very lonely, grief, sorrow, whatever that. Ask the patient. If you can ask the patient, then automatically the feeling will come, and then you'll be able to prescribe. I got I got asked for one symptom of woman 65 froth last week, early evening at the same time. From nose started bleeding. I don't have any other symptom or case. The blood is dark in color. I got asked for one symptom of a 60-year-old froth last week, early evening at the same time. Nose started bleeding. Now see, whenever if you get this type of symptom, you feel that you cannot get this symptom. So we have to go in a generalized matter. Yeah, early in the morning, then you have to basically think about remedies which are very very common in those cases, where you can think about ammonium. There's one remedy which is very very important, which will go with your case, Dr. Smith. First is ammonium carb, of course. Think about ferrum picricum. I have got very good results with ferrum picricum. Third, millefolium, and fourth, ipecac. These four remedies I think would be able to serve you. I hope in Instagram now people can hear what I speak. The lady is on vacation. You can. I have 3-4 remedies: ammonium carb, ferrum picricum, ipecac, and millefolium. Of course, these are the very basic remedies. There are hundreds of remedies, but look at that side, and if you can confirm with the patient which side of the nostrils. Sometimes the patient comes and tells you that only the left side has a problem or right side has a problem. Then sometimes the remedy changes in this case also. So basically, look at the sides of the nostrils also, and then you can see and you can prescribe better. I have missed your advice. Yes. Yeah, Dr. Aurora. Yeah, I also saw your name, but this question was scrolled up. So thank you for writing questions again. Kali family, I'll discuss it. It'll take some time, Dr. Sarma. I've missed your advice on the case 19 years after C-section delivery, pain in the nerves in both hands, elbow, thumb, in wrist. Doctor suggests termination. Yeah. So whenever if you get a case, whenever if you have neuralgia, especially after operation, if you have read, which remedy, I think neuralgia, if you have read, if you see, I think allium cepa also. If you see allium cepa also, it has symptom of neuralgia. Then ask the patient to make a beautiful modality. When is the neuralgia more? Morning, evening, night, and how is the pain? For example, I'll tell you, if the patient has only neuralgic pain after C-section, then you have some remedies are very common. Some remedies are very common that you always think about, like allium cepa is a remedy. Rhinoglobulus is there. Hypericum is there. There are a lot of remedies. I'm sorry, I think in Instagram you cannot hear me, but we'll post our YouTube live on Instagram if it is possible. I have to ask my assistant doctors who are handling that. I think this is not proper. You can just check this. Okay, forget it. So Instagram I'll post again if it's not working. Neuralgic pain, we are thinking about remedies like, so if now neuralgia, normally what happens, it is sometimes radiating. That is important. Where? In the ovaries, in the uterus, it comes and goes. That is important. So at the time of neuralgia, there is a lot of pain, there is a lot of congestion. Then also the remedies changes. After, yeah, I'm telling you that only. Neuralgic pain after, I'm telling you that only. After if there is a neuralgic pain after C-section in the abdomen, then basic remedies if you want, I can tell you. You write the remedies. First would be Macphos. Second would be Plumbum metallicum. Third would be again Nux vomica. Fourth would be Veratrum viridi. Fifth would be Pulsatilla. But basically, I would like to ask the patient, when is the neuralgia pain, or how is the neuralgia pain, and how is the extension of the neuralgia pain. It is going around the stomach, on the left side, on the right side, to the chest, in the inguinal region, in the morning or in the evening or in the night. Then the symptoms becomes a defining symptom of that particular part. In general, you can think about Macphos, Nux vomica, Plumbum, or Zincum metallicum also, Veratrum also. But defining a part symptom, that becomes a 3 marking symptom, and then you can prescribe it properly. Okay? So I hope you understood that. We are just ending that Instagram live because you cannot hear it. Did you understand that? Neuralgia in hand, thumb. Then you have to think about symphytum or allium cepa. And don't always miss about Macphos. These 3 remedies are very, very important in case of neuralgia in the hand and thumb also. Dr. Madan says, mother told about panicky of accident. Patient is son, now 42, has too much anxiety. See, when this patient was in the womb, and if you are taking that symptom after 42 years also with anxiety, I think don't take that symptom for prescription, because anxiety is a soric symptom, you know. And 42 years is basically a very, very long period, because if that was a disease part, then it would have become basically psychosyphilitic, no? So don't take that element from trauma in the womb. After 42 years, the patient is suffering from just anxiety. If that was a traumatic wound at the time of pregnancy, that means the patient should have progressed from sora psycho to syphilis. He might be having problem of fear, panickiness, bipolar, schizophrenia, lot of other things. Just anxiety after same 42 years would be very surprising, and to prescribe also, because that does not carry more weightage in this case, unless it becomes a syphilitic expression. I hope you understand what I mean to tell, Dr. Madan. So as we go further, then in the non-verbal communication, a very, very important thing comes, you know. The patient says, lot of patient comes and say, whenever I wake up in the morning, when there is a collapse, only wants to sleep. In a 93-year patient after gallbladder surgery, no pain, but all wants to go to sleep. Oh, so such a very, very important symptom, you know, such a very, very important symptom. And if you have seen if the patient only wants to sleep, then you can think about remedies like we have opium, we have antim tart. But I'll tell you one of the very interesting case, Dr. Alexandra, and that has given me fantastic results. Think about Ethusia synapium. It is written in that remedy, weakness and prostration with sleepiness. Of course, it is written after stools or after spasms, but I have seen in many of cases when there is prostration and weakness with sleepiness, think about Ethusia synapium. In your case, you can think about antim tart, Nux mosquita, or you can think about tabacum, carboage, and Lobelia inflata. Such a very, very interesting remedies, you know, this. But I have got a very good result with Ethusia synapium. I never thought that Ethusia would work, but it worked. In the same way, don't forget the Indian tobacco, that is Lobelia inflata. Again, a very, very interesting remedy when there is complete and prostration, there is nausea, there is sweating, there is marked prostration, there is extreme sensitiveness, cannot bear the slightest touch, with prostration and coldness, like camphor, like tabacum. So these are the remedies in a 90-year-old thing. you must think about these 5-6 remedies. Of course, ask few symptoms, because with this symptom there are 6 remedies. So after the 6 remedies, ask some leading questions to that patient so that you can differentiate some remedies and then able to prescribe. But do think about lobelia inflata also and Aethusa cyanopium also. Yeah, so that's why I'm telling you. That's why I did not tell you opium, I did not tell you gelsemium, and I did not tell you Nux moscata and Antimtat first. Because in my practice, whoever doctor joins me with this symptom, these 4 remedies become like specifics. No, you give opium, you give Antimtat, you give tabacum, or you give sometimes carbovage. It does not work. But it could, with sleepiness, see, weakness with sleepiness, think about these remedies. Ethusa cyanopium, think about Antimtat, think about Nux moscata, think about lobelia. These are very, very interesting remedies, because if you understand there's pneumogastric nerve involvement in Antimtat, or in tabacum cerebral irritation, or Indian lobelia inflata cerebral irritation, these are very, very, very important symptoms and can help your patient who is 93 years of age, So, can we go further? Lobelia, if you have, I think if you have not seen lobelia inflata, you must hear lobelia inflata. It is written that, I am not getting the exact words, but it is written that lobelia inflata bears the same relationship that Nux vomica does to the person of the opposite temperament. That is lobelia. She eats and even goes to the toilet by herself, but immediately she wants to go to lie down. Yeah, so you can take these remedies. You can take that. Weakness and prostration, Aethusa cyanopium is an important remedy. And of course, if you then see, if you are just understanding, okay, after stools there is weakness, then you can have so many remedies, after stools. But these are the old persons, then you can think about remedies. The patient can scarcely scarcely do anything, and just wake up, and after stools he's absolutely tired. See, he's using his lot of energy after stools, by passing stools. So he's 93, he's so diseased, automatically he'll be wasting his energy, or he'll consuming his energy. And if you go with mater remedica, it is written in one remedy, during menses the patient is scarcely able to stand, and the remedy is cocculus indicus. In the same mater remedica, in the same line, it is written, the patient is very weak during stools or after stools. That remedy is also cocculus indicus. So you can think about cocculus indicus also, like we have cocculus indicus, we have alumina, we have carbo animalis, but after stool weakness also is covered with cocculus indicus. So you can, in this case, think about cocculus indicus. I think I've told you something about cocculus indicus. It's a very, very interesting remedy, where it is okay. You already have that remedy, cocculus indicus. You can try. Okay, we have next question. Anybody? No questions of that. I think there are a lot of doctors who are asking questions now. Today there are no questions. Yeah, okay. She's a famous actress. It is possible. It is possible, yeah. Then you have to think about remedies which we have mentally given up. So persons of, I have now, which is the remedy can you think about? Doctor, any doctor. She's a film star, very famous, now 93. She does not think that she's worth it, and now. Then I told you one remedy, best persons, best suited to persons of originally strong constitution, now have just changed the constitution, because of long succession of moral emotions, grief, care, and disappointed affections. That remedy also you can think about. Which is that remedy I'm talking about? Anybody? Anybody? Not aromat, not conium. My God, I am taking so much effort to teach you remedies, but you are forgetting only. persons of originally strong constitution. Yes, phosphoric acid. Phosphoric acid. And now I give you one more sentence, persons, stout persons, once very robust, which have become debilitated or even broken down, but from exhausting discharge. Then which remedy? Anybody? Broken down because of exhaustive discharge. Then Dr. Babel, which remedy can you think about? Caustica. Okay, anything else? Anything else? Whenever the patient, if you have these type of symptoms, broken down because of exhaustive discharge, did not understand. Okay, for stout persons who are once very robust, who have become debilitated or broken down from exhaustive discharges. So we have remedies like causticum, camphor, sulfur. No. We have, we'll give one chance to Dr. Babel, and if he can answer, then I'll tell the remedies. Think about only two remedies. First, no, not veratrum. Broken down because of exhaustive discharge. This is the beauty of Mater Medica. One remedy is Cinchona officinalis, and the second remedy is, this is the beauty of a Mater Medica. Everything is so beautifully written. You have to just open the eyes and see. One remedy is China, right? And the second remedy, write down, it is Carboveg. These two remedies are very, very important. Originally strong, robust constitution, broken down, debilitated from exhaustive discharge. Think about Carboveg and think about China. Phosphoric acid, I told you about, debilitated, and then it is there in lack of, because of loss of vital fluid is there, but more important, long succession of moral affections like grief, care, and disappointed affection. That's also phosphoric acid. Simple. You have a case, comes to you with depression, no desire to do anything, losing weight, and you ask him why. He said that I was in love with a girl, she married, and now I feel what to do. There is nothing in life, and I was originally doing gym and all. I was 75 kgs. I had a lot of good body, bicep, triceps. Now I'm 40 kgs, no desire to live. That is phosphoric acid. That's phosphoric acid. Okay. Not only stout persons who have lots. Basically, whenever we are talking about a constitution, it is the whole constitution. It's the whole constitution in China. So I hope everybody enjoyed it. So I hope everybody enjoyed it, and it's already 1 hour, and it was nice having a lot of questions, and I hope you understand what I want to teach you about Mater Medica. Mater Medica is a beautiful subject. Don't only think about one part of a remedy because you have read only that part of the remedy. You have to basically think at the other side of Mater Medica and then understand the remedy. Don't be very curious. This is. It's a very vast subject. Everybody can fail. I also fail, but read Mater Medica beyond what you have learned now. That is what I wanted to tell you something about today. Okay, so thank you very much. Thank you for joining. Until next time, goodbye.